Yeah, I am Gina Grimes and I'm the Principal Social Worker and Safeguarding Lead for Stoke-on-Trent City Council for Adult Social Care. My job is a new job to me, so I've only been in it for a couple of months, so I'm very new to this job, but previously I've been in social care for the last 20 years. So I am a social worker by background, trained as a social worker. And my job involves working with adults over the age of 18 who have got a care and support need, which is very, very wide. So that can be all sorts of different needs, all sorts of different reasons why you might come to social care. And that's basically very broadly what a social worker does. My typical day has changed recently because I have changed in job. So as a principal social worker, my role is to be the voice of the social workers. So the social workers on all the various different teams. So we've got mental health social workers, learning disability social workers, generic wellbeing teams, so locality teams. We've got staff that work in the hospital. We've got staff that work in the community, and my job is to sort of pick up all of what's going on in all the areas to feed that back up centrally to the senior managers, to say that this is what the issues are, this is what we need training in, this is what they're saying, you know, there's a gap here, or this is working really well over there. We've seen some really good practice in this area, can we do it in that area? So my job is to try and bring it all together and be the voice for the social workers. And I think to be able to do that, you need to have done the job, which I have. So I've got a good oversight of what the role is. So that's a typical day for me, would be to speak to the staff, see what's going on, attend various meetings. There's lots of different meetings. Also look at the training for the staff, what they might need. But also if there's a particularly complex case, or if there's something that we're just not sure about, we might have what we call a practice forum. So we get together in a little huddle to say, right, what should we do? If we did this, how would that look? If we did that, what would that look like? So I would be involved in those discussions. And because I'm the safeguarding lead as well, if there's anything going on in terms of safeguarding, anything that I need to be aware of, then I might be in a meeting to discuss that. But safeguarding is in every single case. So that's the bread and butter of what we do, really. So that would be involved in everything anyway. So it's really broad. I can't really give you this is what I do every day, because it's very broad in what I do, but I've never been bored and I'm always doing something different every day. So my background, my experience to date really is I went to university to do a degree in social sciences, which didn't really train me to do anything. It just gave me an academic degree, really. So I finished that and I had a great time and I made loads of friends that I'm still friends now, but the degree didn't really give me a job. So when I finished that degree, I decided I wanted to go into the care sector. So I got a job working with children with disabilities, and I loved it. And that was very practical, hands-on care. And I did that for about 3 or 4 years. And I did shifts, and one day I was on a night shift with this guy who was training to be a social worker, and he started telling me about social work and what it is, because I didn't really know, never really, you know. And he said, you know, you could go and do that. You've got some experience. And so I looked into it and applied, and I did my social work degree. And from there, I did a placement here at Stoke, my second placement. And off the back of that placement, I got a job as an unqualified social worker, so an social care assessor. And the rest then, I just stayed in Stoke because I really loved the people I worked with, and ended up being a social worker on the team that I was a student on. And then I've moved around a lot since then. So I've been on various different projects. So I was on, it was called the Troubled Families team. I'm not sure we'd use that term now. And that was very much about working with different partners. So the police, health, the fire service, voluntary sector, domestic abuse charities, And that was a real eye-opener for me, because there's so much out there. There's so many different strands of social work. So from there, I moved into another job that was about communities and working in knowing your area, knowing your people. And I've just moved around, really. I've always been interested in sort of community focus and rehabilitation. So people, the community looking after its own people. So if you live in an area, then you can access things in that area that will support you. So I've always been interested in sort of a rehabilitation, community, locality focus. So I've tended to move into those teams, and now I'm here, a principal social worker. So yeah, it's been a good journey for me. But I think the thing that I would take from it when I look back is get some experience, get some real experience, some hands-on care, whether that's, you know, with children, older people, whether it's with, you know, multiple disadvantage, homelessness, whatever. That backing really sets you up. The main skills is listening. You need to be able to listen and actively listen. So you're not just having a conversation, you're really hearing. You're not thinking about your next question, you're listening to what somebody's saying. And to really be a good social worker, you need to be able to build on somebody's strengths. So you don't see, they call it the deficit model, I think, which basically means you're going in and you're saying, right, what can't you do? So you're struggling with this, you're struggling with that. And what that does for that person is make them feel like, oh, I'm just failing. Whereas if you can go in and you can pick up on the strengths that somebody's doing well, even if it's just one thing that you can find, that starts a relationship, and you'll be a good social worker then, if you can do that.